Patients that have tight hips and you're trying to increase their mobility of the hip, have you tried using a band yet? Take a look at this. So let's put a band around a femur and have our patient do a squat as we move them laterally. Or maybe we want to move them posteriorly. So we go here and have them squat, or maybe even have him take a step with your left foot and lunge, and then we can really move that hip. Or we could realize that putting a band around the deepest ball and socket joint in your body is not going to mobilize it, especially when it's surrounded by the biggest muscles in your body. So all we're doing is putting pressure on this muscle. So if you do get short-term increased range of motion from this, it's not because you mobilized their hip. It's most likely because you massaged or stretched the muscles around the hip, which will increase short-term range of motion because, as we've talked about before, that's how you decrease muscle facilitation and strength. So rather than doing some kind of goofy gimmick like this that's never going to work, what you should be doing is having your patient go through a full range of motion in aplanar motion with transverse plane components while they're in weight bearing, getting in and out of the full range of motion in order to increase long-term motion, strength, and stability, which is MoStreBility, which is way better than flexibility and beats mobility any day of the week.